A man who had traveled to Canada has been diagnosed with the monkeypox virus, a rare and potentially fatal disease, the Massachusetts Department of Public Health reported on Wednesday. This is the first report of monkeypox this year in the United States. Officials in Texas and Maryland recorded one case each last year. But the new case follows a series of unusual clusters in other countries that have begun to alarm public health officials. In the past few weeks, Britain has identified 9 monkeypox cases. Only one patient had recently traveled to Nigeria, where a strain of the monkeypox virus has been commonly seen, while the remaining British patients, who did not travel, may have acquired the infection through community transmission. 3 patients shared a household.
Infection, originally identified in the 1950s in monkeys, and then the first human case in 1970. Most of the cases have been reported really out of West Africa or Central Africa. The cases that have been outside of that area have been reported to be related to travel or to animals. I mentioned rodents. Well, there was an outbreak in the United States in 2003 involving many states, and that was associated with prairie dogs. In the last year, there have been 2 cases in the United States in November and then in July. Both of those were associated with travel. And I think that's a really important piece about this, that the epidemiology over the course of the last week or so, several days, it's becoming clearer that is shifting. And so there's a new epidemiology to be considered. And Dr. Sanchez was very clear about being vigilant. And this afternoon, the MDPH released some guidance for clinicians of the things to look for, both clinical symptoms and risk factors. So I really urge clinicians out there to take a look at that and be prepared.
But how do we think this person got it?
So that's something that I'm not sure if public health authorities want to comment on, but there are some known risk factors that have been identified in this population so far. And this is just coming out right now in terms of what the United Kingdom has identified and what has been released by public health authorities. And the risk factor here has been men having sex with men, and so that's sort of close contact. And that makes sense because the way this is spread is through both respiratory droplets with very close proximity, face-to-face respiratory droplets, but also direct contact with the lesions that have virus in them.